Welcome to the office.
Welcome back.
Doctor, good to see you again.
Good to see you. This is day 2.
This is day 2.
How did you do first with your adjustment?
I think first with my head, it felt like now it's on a very well lubricated ball socket.
Movement's a little bit better.
Yeah, basically no friction. It felt weird not to have friction.
Any lightheadedness or dizziness over the weekend?
And it felt really good.
Awesome. Okay. And the low back?
The low back was good. It was much less pain. There was it was totally fine. And then my upper right shoulder went from a sharp pain to now like a very, very low numbing presence. So that was good. It was good. It was a good weekend.
Not bad with one adjustment, huh?
No, not bad with one session.
You ready to get started?
I am.
So we worked on your tailbone. We worked on your atlas. And your atlas is also very special because it doesn't follow normal plane lines, so I had to alter myself to get a good set. Let's do this. You ready?
I think so.
All right. Let's take a look and see where we're at here, starting at the base of the neck. 5 points, tiny bit. We're going to continue on, upper cervical. You did really well, dude. And 4 or 5 points in the tailbone. Pressure's already down more than half. Very nice. Penthouse and the basement, sir. Mm-hmm. 1, 2, 3, 4. Let's check that motion. We have something to compare to first visit. Back slowly towards me. This is L5. This is S1. This is S2, S3, S4, right there, but better. So we're going to continue on his rotated. If you look here, we have his rotated sacrum, rotated 2 millimeters, but dropped 4. We were down on S3 with a clockwise torque to bring that foundation up. When we look at the upper cervical, this is all compensating. See, this is interesting. So if you look at my other videos, you think that I'm going to set C2. This whole thing is compensating, but the pressure is at C1. And the angle is slightly down this way, right? It's slightly S to I. So my vector changes just a tiny bit. Scoot back for me, please, sir. Scoot to the left and center on the chair. There you go. Right ear down, left ear down, right ear down, left ear down. Turn left, turn right, turn left. Good. Now let's bring that back. Soft pinch of the SCM, and we're going to set that as an ASLP. ASLP, it's gone posterior, the left lateral mass, so we're going to turn it slightly to center it. Instead of being down here, I need to be up here just a bit. And let's go ahead and feed just like that through the joint. Just a tiny bit. You good? Walk it off once, please. And let's go face down over here, please. 2, 3. Yes, look at that. It already wants to go. Nice and easy there. Good. Can I have you relax the shoulder down? Bring your chin up, please. Good. There. Like butter. Home run. Come off slowly. And let's walk it up. You okay?
Yeah.
Just gonna place those there. And do you want to open the back of your gown so I can watch the dentist?
Sure.
It's already different. Cool. One more time. Nice. Back over here on the chair.
Being on a runway.
What's that?
It's like being on a runway.
It's the catwalk.
Yeah.
Oh, you're showing off your fancy socks today.
Yeah. This one's left.
So you're saying, what do you teach architecture?
I teach architecture, teach urban design.
And the 3 classes you were talking about?
Great Houses of LA, the history of modern urban design, and teaching architecture out in Asia, studio pro.
All clear, dude.
What is that reading picking up?
This is a mini thermography unit. It's picking up heat, right? And so everyone's got these different things of what is this thing really doing. We have, you know, some people say nerve pressure, you know, you hear me say pressure, but the idea is this, okay? Along the paraspinal muscles, we have blood vessels, right? They run down. Those are controlled autonomically at every nerve root. There's a little recurrent meningeal nerve that comes off the nerve root, and it innervates the capillary beds.
That makes sense.
When there's nerve pressure, or when there's misalignment, or when there's irritation or inflammation, there's heat. And so what it's registering is left to right side, is the temperature the same, which it should be, at each consecutive level. Now the top level can be hotter than the bottom level, but side to side should be even. So what it's telling us is there's something going on there. It's part of the exam.
That makes sense.
Okay, now I'm using an old scope. This is from the 30s. Feel it. There's no battery. Just feel the... Some people compare it to the old classic Rolls Royces.
Oh.
And then we have this one. A friend of mine is developing this right now. This is a digital version.
Wow.
And the digital version, feel it. Feel it. It's like a Tesla.
Wow.
Completely different. Now most people can't get these scopes, because can't get them. And if you get them, they're pretty expensive. He's hoping to make this affordable for all students and doctors to have.
That's incredible.
And there's no mechanical parts in there. So I can drop it, just don't drop it on the heads.
On the heads.
I can do this. No problem. I can do this. Pow! Pow! Pow!
But this is cool.
But this one I can't.
This one's cool.
And when I picked up a bunch, this was my first one I bought as a student. So right now, that's heat from, go ahead and do it, that's heat from your finger. Other side. The bigger the number, the more heat differential.
Oh,
Each increment is 0.8 of a degree sensitive. All right, let's machine you out in the back.
Right.
I need to work on your ankles. Get you moving even better than you are. Let's work on your ankles. Raise it up. AS talus, medial tilt. The board is to absorb the shock to make the adjustment easier. There you go.
Wow.
Nice.
It's just it.
I just reset your talus bone, the ankle bone.
Oh.
Okay, on both sides. Now stand up and walk one more time, and you can tell me if it feels even smoother than before the ankle adjustment. Voila.
I don't feel like Pinocchio.
Nice. One more time, sir. You better thank your sister.
I should. I owe her a lot.
Squeeze my hand. Let's check for hands. Elbow, radial head. That's it. Thumb. Lunate. There you go. Squeeze. Lunate. Scaphoid. That's your mouse hand. That's your mouse hand.
Or the little.
Okay.
Huh.
Continue your walking. We
Yep.
said 10,000 steps.
Yep.
And leave it at that.
Okay, thank you.
You're welcome, sir.
Okay, thank you.